Have you noticed your legs feeling heavier lately? Maybe it's harder to stand up from a chair, or you find yourself grabbing the handrail when climbing stairs. You assume it's just aging, normal wear and tear, right? But what if I told you that this weakness isn't about age at all? Hi, I'm Dr. James from It's Better Health, and today we're exposing a silent but reversible reason why millions of seniors over 60 are losing strength in their legs, not over decades, but in just a few short years. You see, after 60, your body doesn't absorb nutrients the way it used to, and without key vitamins, your muscles quietly lose power. No warning, no pain, until one day, you need help getting out of bed. The good news? You don't need intense workouts or expensive therapy. In fact, studies show that just 3 specific vitamins, taken at the right time, can start restoring your leg strength in a matter of days. We're not talking about fads. We're talking about real science, proven results, and simple changes that anyone can make. So stay with me, because in this video, we'll uncover the 3 essential vitamins every senior over 60 must know about, how these nutrients power your balance, mobility, and confidence, and how to combine them for maximum effect. No guesswork, no gimmicks. If you're ready to reclaim your strength and take back your independence, type yes in the comments. And don't forget to hit like, subscribe, and tap the bell so you never miss another tip from It's Better Health. Now let's dive in, because stronger legs and a stronger life start right now. Section 1. Why legs weaken first. The 3 core reasons. It usually starts with something small. You avoid the stairs. You pause before rising from the couch. You grip furniture when walking across the room. It feels like aging, but it's not just age. The truth? Your legs are the first to go, and there's a scientific reason behind it. According to the American Geriatric Society, seniors lose 1 to 3% of muscle mass every year after 60. And because your legs house the largest muscle groups in the body, they're hit first and hardest. So why does this happen, even if you eat well and stay active? Let's break down the 3 biggest culprits behind leg weakness after 60. Number 1. Vitamin deficiencies, the silent muscle killer. As we age, our digestive system becomes less efficient. The stomach produces less acid, and our intestines become less effective at absorbing key vitamins like D3, B12, and thiamine, also known as vitamin B1. These aren't just general health nutrients. They directly impact muscle contraction, nerve signals, and energy production in the legs. A deficiency in just one of them can mean slower reaction time, poor balance, muscle fatigue, cramping or heavy, dead-weight legs. Worse, most seniors don't even know they're deficient because the symptoms are often blamed on aging. Number 2. Poor circulation, the oxygen supply crisis. Even with all the right nutrients in your body, poor circulation can block their delivery. As arteries narrow with age, the blood flow to your lower body decreases, starving your legs of oxygen and essential fuel. The results? Cramps after short walks, swollen ankles, that dragging sensation after just a few minutes of standing, cold feet or numbness at night. Think of it like a delivery truck that can't get through traffic. The fuel is there, but your legs can't access it. Over time, your muscles shrink, fatigue sets in faster, and strength disappears. Number 3. Reduced activity. The muscle you don't use, you lose. The final culprit is one we can actually see. As we age, we tend to walk less, take the elevator more, and avoid high-effort tasks like lifting or climbing stairs. Here's what most don't realize. Just 1 week of inactivity can result in muscle loss. And when that inactivity becomes a routine, your body enters a cycle of atrophy. where muscle cells shrink and strength is replaced by weakness. Even worse, when your muscles are underused without proper nutrition, they don't recover. They just deteriorate further. The longer this continues, the harder it is to reverse. Bottom line, your legs aren't getting weaker just because you're older. They're getting weaker because your body is underfueled, undercirculated, and underused. But here's the hopeful part. With the right nutrients, better circulation, and a few smart habits, you can stop the decline and start rebuilding. So now that you know why your legs may be giving up on you, let's talk about how to bring them back. Up next, we reveal the 3 powerhouse vitamins that can restart muscle function, revive your balance, and reclaim your confidence, often within just a few days. Ready? Let's dive in. Section 2. 3 essential vitamins for leg strength. So now we understand why the legs weaken first. The question is, what can you actually do about it? Most people think the answer is exercise, or pricey protein powders, or physical therapy. But what if the fastest way to revive your leg strength was already in your kitchen cabinet? The truth is, you don't always need more workouts. You need the right fuel. And for seniors, that fuel comes in the form of 3 essential vitamins. These aren't trendy supplements. They're clinically studied, doctor-recommended, and often missing from senior diets, even if you eat relatively well. And each one plays a critical role. One controls your body's master energy switch. One connects your brain to your legs. And one literally powers your muscles to move. The best part? When taken together, at the right time, in the right way, they can transform how your legs feel in just days. If your steps have been slower, if stairs feel steeper, or if you've started second-guessing your balance, this section is for you. Let's begin with the vitamin that turns the lights back on for your entire neuromuscular system, vitamin D3. Vitamin number 1, vitamin D3, the switch that reactivates your legs. If you've ever felt like your legs are just not responding like they used to, slow, heavy, or unreliable, vitamin D3 could be the silent fix you've been missing. Most people think of vitamin D3 as the bone vitamin, but after age 60, it becomes something far more powerful, a master switch for your entire muscle, bone, and nerve system. Here's why that matters. As you age, your body's ability to make D3 from sunlight drops sharply. Thinner skin, less sun exposure, and slower liver and kidney function all mean your system gradually loses the ability to activate movement. You don't feel it overnight, but one day, walking up the stairs feels harder. Getting off the couch takes more effort, and your legs no longer feel like yours. This isn't just aging. It's vitamin D3 deficiency silently weakening your body's foundation. Why vitamin D3 is so important for your legs. Vitamin D3 does 3 crucial things for seniors. Enhances calcium absorption, keeping your bones strong and stable, critical for leg support. Maintains muscle fiber strength and contraction, allowing your legs to move smoothly and respond quickly. Supports nerve signaling, helping your brain communicate properly with your legs. Without enough D3, your muscles lose strength. Your nerves misfire. Your balance fades. It's like trying to drive a car with low battery. Everything feels sluggish and uncertain. Real signs of D3 deficiency in seniors. Think you might be low on D3? Watch for these red flags. Leg weakness, especially when climbing stairs. Sudden fatigue just from standing or walking. Nighttime leg cramps. Trouble with balance or coordination. Deep aches in hips, knees, or heels. Even mild anxiety or trouble sleeping. These aren't normal signs of aging. They're your body's early warnings that your vitamin D3 tank is running low. What the science says. Clinical studies back this up. A University of Birmingham study found that seniors supplementing with just 800 IU of D3 for 5 days increased leg strength by 19% on average. Another study from Harvard's Geriatric Research Center showed that older adults with low D3 were 40% more likely to suffer falls or be hospitalized. And here's the key point. These improvements happen without changing exercise routines. Just by restoring D3, seniors walked with more confidence and less pain. How to take vitamin D3 the right way. Recommended dosage: 800 to 2000 IU per day. Best time to take it: morning or early afternoon. With food? Yes. D3 is fat-soluble, so always take it with a meal that contains healthy fat, like eggs, salmon, or avocado. Avoid taking it at night, as it may interfere with sleep in some individuals. Can you get enough from food? Unfortunately, it's tough. 3 ounces of salmon equals 500 IU. 1 egg equals 40 IU. 1 glass of milk equals 100 IU. To hit 1000 IU per day consistently through food alone would require an unrealistic diet for most seniors. That's why a simple supplement is often the most effective and reliable way. Who should prioritize D3 right now? You especially need to supplement if you're over 60 and spend little time outdoors. You've had a fall or near fall recently. You feel unsteady or weak in the legs. You have osteoporosis or joint pain. You follow a plant-based diet low in dairy or fish. But don't overdo it. More is not always better. Excessive long-term D3, over 4000 IU/day, can lead to side effects like kidney stones, nausea, or calcium imbalance. Stay in the recommended range and get your levels checked annually. In short, vitamin D3 doesn't just support your bones. It reawakens the muscles and nerves that keep your legs strong, balanced, and steady. It's one of the simplest, safest, and most effective ways to restore confidence in every step. Ready to move with strength again? Let's move on to the second critical nutrient, vitamin B12, your brain-to-leg connector. Vitamin number 2, vitamin B12, the brain-to-leg connector. If vitamin D3 is the switch that turns on your muscles, then vitamin B12 is the wiring that keeps them connected. Without enough of it, your legs might still have power, but they won't get the message. And sadly, that's exactly what's happening to millions of seniors right now. Your brain tells your legs to move, but with low B12, that signal travels slower, weaker, or gets lost altogether. The result? Legs that feel numb, tingly, weak, or disconnected, like they don't belong to you anymore. Why B12 matters more after 60? As we age, 2 silent problems set in. Our stomach produces less acid, and acid is essential for absorbing B12 from food. We eat less meat, fish, and dairy, which are the main sources of this vitamin. Even if you're eating healthy, you could still be B12 deficient, and your legs are often the first to show it. Signs you might be low in B12: tingling or numbness in your feet, feeling like your legs are asleep or not responding, trouble with balance, even on flat surfaces, weakness or heaviness in the lower body, needing to use your hands or furniture to stay steady, brain fog, forgetfulness, or low mood. Most people chalk this up to just getting older, but in reality, it could be a fixable vitamin deficiency. The science behind it. Let's look at what the research says. A study from Oxford University showed that seniors with low B12 levels were more than twice as likely to suffer falls and had significantly worse balance and slower walking speed. In another clinical trial, Seniors who took 1,000 micrograms of B12 daily for 8 weeks reported less numbness, better lower body coordination, quicker reaction time when walking or climbing stairs. It's not just about energy, it's about restoring the connection between your brain and your legs. How B12 supports leg strength. Vitamin B12 protects your nerves by forming the myelin sheath around them. Enhances oxygen delivery by supporting red blood cell production. Accelerates brain-to-muscle signals, helping you walk more confidently and avoid falls. Improves energy metabolism, so your muscles get the fuel they need. This means better balance, steadier steps, and a reduction in that wobbly feeling when moving around. Who's at risk for B12 deficiency? You should seriously consider checking your B12 levels if you are over 60. Take acid-reducing medications like omeprazole, ranitidine. Eat a mostly plant-based or low-meat diet. Take metformin for diabetes. Have digestive issues like IBS or gastritis. Drink alcohol regularly. Have had weight loss surgery or GI-related procedures. Even if you feel fine, a simple blood test can reveal if your nervous system is silently struggling. How to supplement B12 correctly. Recommended dosage: 500 to 1,000 micrograms of methylcobalamin daily. Why methylcobalamin? It's the active form your body can use immediately, no conversion needed, which is ideal for seniors. Best time to take it: morning or early afternoon. Avoid taking it with coffee or tea, they reduce absorption. It comes in sublingual tablets, lozenges, sprays, or chewables. Choose the form you'll stick with consistently. Can you get enough from food? In theory, yes. In practice, rarely. 3-ounce beef liver equals 70 mcg. 3-ounce salmon equals 4.5 mcg. 1 large egg equals 0.5 mcg. 1 cup milk equals 1 mcg. You'd need to eat a lot of liver or seafood daily to meet your needs, something most seniors just don't do. That's why supplementation is not just helpful, it's often necessary. Is B12 safe? Extremely. B12 is water-soluble, meaning any excess is flushed out in your urine. Even high doses are well tolerated in most people. The only caution: if you're taking blood thinners or have chronic kidney disease, talk to your doctor first. Bottom line: vitamin B12 doesn't just boost your mood and memory. It reconnects your legs to your life. It's what allows your muscles to obey your brain and your body to feel stable again. Want to walk without fear of falling? Let's move on to the third and final vitamin that fuels your muscle energy: vitamin B1, your movement ignition key. Vitamin number 3, vitamin B1, thiamine, the ignition key for movement. If vitamin D3 is the switch and B12 is the wiring, then thiamine, also known as vitamin B1, is the spark. It's what turns fuel into power, so you can stand, walk, climb stairs, and keep moving through life without feeling like your legs are made of bricks. And yet, despite its critical role in energy production, vitamin B1 is one of the most overlooked nutrients in people over 60. Why vitamin B1 is essential after 60? Every time you move, your body converts food, especially carbs, into a type of fuel called ADP. That fuel powers your muscles, nerves, and brain. But here's the catch: vitamin B1 is the co-pilot in that conversion process. Without it, the engine stalls. That's why, even with normal blood sugar or a decent diet, many seniors still feel like their legs are too heavy to lift, cramping in their calves or feet after walking, easily winded going upstairs, a sense of sluggishness that rest doesn't fix. This isn't just aging. It's the quiet exhaustion of thiamine deficiency. Real signs you may be low in B1. You might not realize it, but the following symptoms can all stem from inadequate thiamine. Legs that feel tired after light movement. Foot or calf cramps, especially at night. That dragging sensation when walking. Feeling short of breath with minor exertion. Occasional dizziness after standing. General lack of energy or mental clarity. Low motivation to move or engage in daily activity. These early signs are often ignored or blamed on aging, but they're the body's way of crying out for cellular energy. Why seniors are at higher risk for B1 deficiency. Several hidden factors make vitamin B1 harder to maintain as we age. Number 1. Reduced absorption. Older digestive systems absorb less thiamine from food. Number 2. Medications. Common drugs like diuretics, metformin, or antibiotics can flush B1 out of the system. Number 3. Alcohol use. Even moderate wine or beer intake can impair B1 metabolism. Number 4. Processed foods. Many seniors eat food stripped of B1 during manufacturing. Number 5. Low whole grain intake. Most natural sources of B1, like brown rice, lentils, and seeds, are missing from modern diets. The science behind thiamine's role in muscle energy. Thiamine powers the Krebs cycle, your body's main engine for making ADP, the energy molecule your muscles rely on. Without enough thiamine, muscle cells fatigue faster. Nerve signals travel more slowly. Recovery after movement takes longer. Think of it like this. Your legs may have muscle, but without B1, there's no fuel to fire them. What the research says. A 2021 study from Tokyo University found that 30% of seniors had thiamine deficiencies, and those people had much weaker legs and were more likely to complain of early fatigue and poor mobility. Another study from the Journal of Neurological Sciences showed that patients who took 100 milligrams of thiamine daily for just 7 days reported better endurance, less heaviness in the legs, faster walking speed, fewer cramps, and improved recovery. In short, restoring B1 can restore your drive, not just physically, but mentally too. How much do you need? Standard daily dose, 1.1 milligrams for women, 1.2 milligrams for men. Therapeutic dose for seniors, 50 to 100 milligrams per day, especially for those with fatigue, leg heaviness, or nerve issues. Best time to take it, with breakfast, so it fuels your energy all day long. Avoid taking with alcohol, coffee, or black tea, which reduce absorption. It's water-soluble, so excess amounts are flushed out safely. Can you get it from food? Technically, yes. But practically, most seniors don't eat enough of these B1-rich foods daily. Brown rice, lentils and beans, sunflower seeds, pork or organ meats, whole grain breads and cereals. And if you're on diuretics or metformin, your body loses B1 faster than food can replace it. That's why supplementation is often the most reliable way to restore energy. Who should consider thiamine supplements? Anyone over 60. Anyone taking blood pressure meds, diuretics, metformin, or antibiotics. Anyone with type 2 diabetes. Those experiencing unusual fatigue or heavy legs after light activity. Those with poor appetite or unexplained weight loss. Those who drink alcohol regularly. Anyone with digestive conditions like IBS or acid reflux. A simple vitamin can reverse that sluggish feeling in just a few days. Final thoughts. Vitamin B1 may not be flashy. It's not trending. but it could be the missing spark that reignites your ability to move with ease, climb stairs without fear, and take on the day with confidence. If your muscles feel drained, your mind feels foggy, and your motivation is running low, B1 may be the breakthrough you didn't know you needed. When combined with vitamin D3 and B12, it completes the power trio that rebuilds your energy, reconnects your nerves, and strengthens your legs from the inside out. Section 3. How to combine these three vitamins for maximum strength. Now that you know exactly how vitamin D3, vitamin B12, and vitamin B1, thiamine, each support your leg's strength, balance, and mobility, the next question is simple. How do I take them together for the best results? The answer isn't complicated, but it is powerful. Because when you combine these three the right way, they don't just work separately, they amplify each other's effects, like a well-oiled engine humming back to life. Timing is everything. Let's start with when to take each vitamin for best absorption and effect. Morning with breakfast. Vitamin D3, best absorbed with healthy fats like eggs, Greek yogurt, or avocado toast. Vitamin B1, thiamine provides energy for the entire day. Take it early to fuel your movement and focus. Midday or lunch. Vitamin B12 boosts alertness and nervous system performance. Ideal to take at lunch to avoid sleep disruption. Avoid tea or coffee around this time, as caffeine may reduce B12 absorption. Pro tip: always take your vitamins with food to improve absorption and minimize any risk of stomach discomfort. Real-life example, your vitamin-powered day. Here's what a typical senior-friendly vitamin routine could look like. Breakfast. A small bowl of Greek yogurt. One boiled egg or slice of avocado toast. Take vitamin D3 plus vitamin B1 with this meal. Lunch. Grilled salmon or tofu. Steamed spinach or broccoli. Take vitamin B12 with this meal. Dinner. Light and plant-rich. No additional vitamins needed here. Your body is already fueled. This simple routine gives your body everything it needs to rebuild strength, restore nerve communication, and fuel muscle movement, without disrupting your sleep or digestion. What about multivitamins? If you're already taking a multivitamin, here's a quick checklist. Does it contain at least 800 IU of D3, 500 micrograms of B12, and 50 milligrams of B1? If not, you may need to supplement individually. Many senior formulas underdose these key vitamins or combine them in ways that reduce absorption, especially if taken on an empty stomach or without healthy fats. So check the label carefully. And when in doubt, individual supplements equals better control, better results. Safety reminders. More is not better. Stick to the recommended doses unless advised otherwise by a healthcare professional. Talk to your doctor if you take medications for blood pressure, diabetes, kidney, or liver issues. Check your levels. A simple blood test every 6 to 12 months can ensure your vitamin levels are right where they should be. One final thought. When taken properly, these three vitamins function like a synchronized team. D3 builds muscle fibers and strengthens bones. B12 restores nerve connection between brain and legs. B1 powers muscle movement and stamina. Together, they form a nutrient strategy that brings back what aging silently takes away. Strength, stability, confidence. Conclusion: one small change, one powerful step. Let's take a step back for a moment. If your legs have felt heavy, if you've been stumbling more often, if getting up from your chair feels harder than it used to, you're not broken. You're not too old. And it's definitely not too late. What we've uncovered today is something most doctors overlook and most people never hear about. Vitamin D3 reignites your bones and muscles. Vitamin B12 restores brain-to-leg communication and balance. Vitamin B1, thiamine, delivers the energy to move with confidence. These aren't exotic drugs or magic pills. They're simple, essential nutrients your body has been quietly missing. But here's the secret. When you give your body what it truly needs, it remembers how to heal. Just like a spark in a tired engine. Just like Harold, who swapped one breakfast habit and got his balance and life back. So here's your invitation from its better health. Don't wait for the fall. Start rebuilding today. Don't accept weakness as your future. Fight for your strength with science. If this video gave you hope, clarity, or a new idea to try, tap that like button. It tells YouTube this content matters. Subscribe to It's Better Health so you never miss a tool to stay strong, clear, and independent every day after 60. And leave us a comment below. Which of these vitamins surprised you the most? We'd love to hear your story, and others in this community will too. Because here, you're not aging alone. You're aging better, with knowledge, courage, and community. Until next time, fuel your legs, strengthen your life. This is your health, your future, and you've got this.